Drug companies say they need to charge ever higher prices to cover their research costs, but they spend in some cases 2.5 times as much on marketing and administration than they do on research and development, and afterwards they actually keep more of the profits. That was Marcia Angel. She's the senior chief in the Department of Global Health and Social Medicine at Harvard Medical School. With everything going on in the world today, there are many problems within this country that get overlooked. One of these problems is big pharmaceutical companies, otherwise known as Big Pharma, and their effects on our health, our bank account, and our government. An extensive range of studies and lawsuits already documents strategies by which pharmaceutical companies hide, ignore, or misrepresent evidence about new drugs, distort the medical literature, and misrepresent products to prescribe physicians. There are lobbying efforts and political contributions. The trade group Pharma has more than 50 current or former staff members who once served in the political arena, including 36 who worked on members of Congress, 13 who worked on federal agencies, 12 who worked for congressional committee, 2 who worked for the White House, and 1 who worked for the court system. Pharmaceutical industry spending to lobby the federal government exceeded $1.5 billion from 1998 to 2008, more than any other industry. The ratio of pharmaceutical industry lobbyists to members of Congress is approximately 2 to 1. These were the top 20 members of the House and the Senate that received money that year from 2013 to 2014. The top one was 358,573, and the lowest being 168,250. Can we trust our doctors? Pharmaceutical companies also have your doctors on their payroll. They spend nearly $20 million annually marketing their products to physicians, efforts that yield profits of nearly $300 billion a year in prescription sales. At the peak of Big Pharma, profitable relationship with the medical industry in 2007, more than 100,000 representatives made visits to more than 650,000 physicians across the country. Representatives also dole out free samples of prescription medication and shower them with gifts, such as take them to sporting events, expensive dinners, and trips to exotic destinations. Doctors are also persuaded to allow ghostwriting, which involves Big Pharma paying physicians to attach their names to positive articles about a particular drug with the goal of seeing it published in a reputable medical journal. Using these connections to pursue industry goals, Big Pharma has a significant competitive advantage over the public interest. These were the top 20 doctors and what they received that year. The top being $7.4 million. They pay him for speaking at events, the royalties to how much drug they sell, their consulting efforts, and their travel taking places. Marketing, research and development, and drug costs. Americans pay more than any other country in the world for pharmaceuticals. The truth is that U.S. law allows drug companies to set prices for drugs and protects them from free market competition. Other countries set a limit on what companies can charge based on the benefit of the drug. New data released by the PBC from Global Data, 9 out of 10 big pharmaceutical companies spend more on marketing their drugs to consumers than on research and development. Johnson & Johnson being the largest, their budget was $17.5 billion, double the $8.2 billion it spent on drug development. And then Pfizer was the second biggest. It spent $11.4 billion, 72% more than the $4.8 billion it spends on research and development. We're also one of only 2 countries in the world where drug companies are allowed to market directly to consumers. This is their expenditure by type of pharmaceutical marketing. The face-to-face sales, clinical trials, the free samples they hand out, their promotional mailings, and their advertisement. Pharmaceutical companies and their effect on our health and our children. A recent growing study showed that 100,000 Americans die each year from prescription drugs, and this was just from side effects alone, not from them getting misprescribed or taking too many. The growing problem with Big Pharma and medicating our youth. In the past decade, America's pharmaceutical industry has knowingly marketed dozens of dangerous drugs into millions. As a result, hundreds of thousands of American kids, some as young as 3 years old, have become dependent on these drugs. None of these powerful, mood-altering medications have been approved by the FDA to treat children under the ages of 10 years old, and in most cases under the age of 18. A study last year found that American children take 3 times more attention deficit medications and antidepressants than children in Europe. Many doctors wonder how these will affect vulnerable brains and bodies. Because of this recent spike in the amount of children being medicated by these drugs, we have yet to see the long-term effects. Other doctors have warned that children exposed to this multi-molecular barrage on their central nervous system could potentially be much higher risk of becoming adults who are addicted to chemicals, prescriptions, and otherwise. Conclusion: Big Pharma appears less interested in the health of the American public than it is in fulfilling its responsibility to its shareholders. And because of Big Pharma's influence is so extensive and self-interest is the motive of its giant network, a well-being society may be in serious jeopardy. Oh.